back with Shapes of Epidemics and Global Disease video series. I'm here with Jack. Would you like to introduce yourself?
Yes, I'm Jack Lesch. I'm Professor Emeritus of History at the University of California at Berkeley.
And now for your chapter of the Shapes of Epidemics and Global Disease titled Four Turning Points in the Treatment of HIV/AIDS. What would you say is your research question?
Yeah, the research question for the chapter can be stated pretty simply. It's where do the drugs used to treat HIV/AIDS come from? And I don't mean it so much in a geographical sense, but in terms of the science involved. And to get at this, I look at the first decade and a half of the epidemic from 1981, when the first cases of AIDS were recognized in the United States, to 1996, when the first combination therapies were introduced also in the United States. And I'm looking mostly at the United States, but also with some reference to France. And part of the work in this chapter, part of the research problem involves classification of the drugs by chemical class and by use. And part of it has to do with periodization. And the question that I ask is within this decade and a half period in the early AIDS epidemic, can you subdivide it into phases or periods? Is that a useful thing to do? And I come to the conclusion that it is. And in the chapter, I lay out what I call four turning points in the treatment of HIV/AIDS, focusing on the drugs. So that's the research problem, essentially. I think it's an important problem. First of all, because medicinal drugs have been at the center of the AIDS epidemic from the very beginning. Even before doctors knew that AIDS was caused by a virus, they were trying to treat the conditions associated with AIDS with the medicinal drugs that were available. In the 1980s, AIDS activism became an enormously important force within the AIDS epidemic, and the AIDS activists concentrated very much on drugs, pushing for more resources for research and development, trying to clear the path for federal regulation of new drugs, trying to modify clinical trial protocols so that people had earlier and better access to experimental drugs, and also setting up networks of information and distribution to make knowledge of drugs and the drugs themselves more available. And finally, I mean, most dramatically in the mid-90s, there was the introduction of combination therapies that were effective. And this began the conversion of AIDS from a nearly 100% fatal disease into a manageable chronic condition. And that has developed since then. And absent a vaccine, the drugs are still at the center of the management of AIDS. Secondly, it's important because we historians, I'm speaking for myself and others, have not done enough, I think, to try to understand where these drugs come from and how they interact with other aspects of the AIDS epidemic. One of the symptoms of this is that if you read accounts of the AIDS epidemic narratives, a given drug may appear in the narrative and then figure prominently in the story for a while, and then suddenly disappear and be replaced by another drug, but without any explanation as to why it appeared in the first place, why it was considered a promising AIDS drug, and why it disappeared. And one example that I look at in the chapter is the drug that was called HPA 20-23. This was a drug that was fairly prominent in the mid-1980s, emerged in France in 1983, and then for a couple of years made a big splash. A lot of Americans went to Paris to be treated with it, including movie star Rock Hudson. But after Rock Hudson died toward the end of 1985, HPA 23 drops off the radar, and we don't know anything more about it. And this is, I think, a representative example, and one of them that I try to look at a little bit in the chapter and try to remedy the lack of knowledge about it. So I think, in general, the importance of the topic is that medicinal drugs have been enormously important in the AIDS epidemic and continue to be, and yet we don't have a sufficient historical understanding of where they come from, how they're discovered, developed, and used. And so I'm trying to work at that in this chapter.